Hello guys, it's again me. Today I met great doctor. He's from Sri Lanka. He's named Dr.Mahanama. Can you please introduce yourself?
Yes, I'm a consultant general surgeon at National Hospital, Sri Lanka. I'm an examiner in postgraduate and undergraduate in the country,
Yes.
and I'm a surgeon for many years now, for more than 2 decades.
He's from Colombo, yes?
Colombia.
Colombo. And Dr. Mahanama, can you advise for? I have many friends in the where I'm living in the Belarus, and many students from Sri Lanka. They are trying to approve diploma in the Sri Lanka. They're so stressing about that. Can you explain how to? Can you give them advice how they should prepare for that, and when they should start to prepare for exams?
Okay, I must say that if you have to follow your medical course properly wherever you are in the world, for example, if you are studying in Russia and Belarus, most important thing is you have to follow your medical course properly.
Okay.
Because we can very easily identify people who have done a medical course and who have not done a medical course.
Okay.
So the most important thing is not to prepare for the final exam. You be a doctor first.
Okay.
So what you have to do is you have to have a sound knowledge of anatomy and physiology. Without those two, you are very unlikely that you will pass a Sri Lankan screening exam.
Okay.
Then after that, the exam, the final exam that you are sitting in Sri Lanka to become a registered doctor in Sri Lanka, we examine you in 4 subjects areas mainly:
Okay.
surgery, medicine, gynae and obs, and then pediatrics.
Okay.
Plus, in addition to that, forensic medicine and community medicine.
Mm-hmm.
They are not difficult. Those 2 non-clinical subjects are not difficult. But if you don't have the basic understanding of a doctor, the other 4 subjects become difficult. So there are many guiding courses. For example, for surgery, the College of Surgeons conduct some courses.
Okay.
And similarly, other specialties also will have a lot of guiding courses in Sri Lanka.
Okay.
The most important thing is to get on with the Sri Lankan doctors and go to regional hospitals and work with them and get an idea about what they do. Plus, follow a standard clinical book. For example, I can't tell you about the other subjects, but in surgery there are standard clinical books like Bailey and Love, then Hamilton Bailey's, Norman Browse, and there are few clinical books which tell you about various surgical conditions. They are very common in Sri Lanka, so you can easily find these patients in all the wards and the clinics. Only thing, the foreign students cannot enter the teaching hospitals where there are local students, because they obviously have various student clashes. So, but there are hundreds of other hospitals where there are consultants and where there are wards and the clinics. And if you hang around those clinics, you can see those patients, plus correlate with your clinical books, get some guidance from consultants.
Okay.
Then I don't think it will be difficult for you to complete the exam. It's not difficult at all. It is a question
It's test like, yes? It's test like exam.
a test like exam.
I can proceed.
It is not a question of the people. I know there are some people who have been failing regularly. Most of them, they could not speak English. So you have to learn your medicine in English, or otherwise you have to translate all what you have learned into English.
Will they check your
We don't mark for the English language.
Okay. Will they check your singular language or Tamil? Which language they check?
No, not at all.
Not at all.
Exams are held in English.
Only in English, yes. Okay. Will it will be difficult for students who know only English language? For instance, they are not so perfect in the singular. Or
No, it's only single, only English. If you know English, you can pass.
You can pass, yes.
Yeah, no problem.
Okay, I was asking yesterday also. I took interview from another doctor, US doctor. I was asking from him, can you advise some tips for students how they have to study from begin, and which points they have to stress, and what they have to do to become a great doctor? Can you give your point of view?
Yes, because all what we learn about this new technology, new things, new operations, new medicine, all they become out of fashion very, very early. For example, what I learned as a medical student about drugs and the treatments and things, none of those treatments are available now.
Okay.
But nothing has changed in physiology and biochemistry and anatomy. And a good doctor should know anatomy well and physiology well. I know people don't study anatomy. That is a problem.
Okay.
Particularly when it comes to high exams, they can't pass if they don't know the basics in anatomy and physiology, of course. Every doctor should know everything about physiology. If you know those two and all the other things, you can self-learn. There are so many books and internet, and nowadays studying is not difficult at all. There were times where you had to go to a library, you had to find a book. If that particular book is not there, you don't know how to find. Now it's not like that. There are so many websites which show you videos, classes, teaching, everything. So it's a question of you knowing the basics. Without knowing basics, without knowing physiology and anatomy, you won't understand what is said in the books and on those websites and TVs and videos.
Okay.
So study medicine. Study the bigger book on physiology.
Physiology first of all.
Like the Gannon. Gannon is W.F. Gannon is one of the index books in many parts of the world.
Okay.
So there are several physiology books which are standard. Sri Lankan students, when they come, of course, they will be told what books to read.
Okay.
Yes, it's not difficult.
Okay. And third question, can you tell please first how to prevent burnout for students while they are studying, while they want to be while they're studying, how to prevent burnout when they become a doctor? Two things, because many students I saw they are telling like I don't want to be a doctor while in a student stage they're telling I don't want to be a doctor, I gave up, I disappointed about this doctorship, everything I disappointed. How they have to prevent it, how they motivate themselves?
One is you must good mentoring. You must work with good people, good clinicians who are working enthusiastically and who enjoy their work. Medicine is not more than a job, it is a hobby also. But if it is a pain for you, it's very difficult to do because you need a lot of time and energy for that.
Okay.
So unless you have a passion, you like this subject, you can't do this. So develop an interest. Be with people who like the subjects and go to, like you have done, go to conferences, go to meetings, go to places where they discuss this subject.
Okay.
And then of course naturally it becomes interesting like any other subject because medicine is vast and then of course so many things to learn. You never get fed up learning medicine. I'm still learning.
Still learning.
So, yes.
After becoming doctor, you have to also motivate yourself, yes?
Yes. So I think you have to have good mentorship, work together. I think it is a teamwork. If you have good teammates and study partners plus go to the wards and work with others, I think you can't study medicine and then practice medicine alone. Today it is a big teamwork, so that I think you must be a team person. If you are a very isolated person, I must say I think it is difficult for you. Unless you are highly intelligent and motivated, it's okay. But most of the people, why they find it difficult is they don't have a team.
Okay.
They should team up.
Okay, so guys, all students from Sri Lanka listen Dr. Mahanama telling you have to come back also, you will approve your diploma. It's not so hard. Am I right?
It's not so hard
It's
at
not
all.
so
It's a
hard,
very
yes.
simple exam.
It
It is one of the simplest medical exams I can imagine.
Yes, it's so simple, that's
It
why.
is designed for a wide range of students who had not followed our own course, but people come from different parts of the world. So we have become very simple, but we ask only standard questions, only standard party standards which is accepted anywhere in the world. That's all we ask. Yes.
Okay, that's why don't stress guys about that, you will get it. Just put own destiny goal and you will get it guys. Thank you Dr. Mahanama.
Okay, son.
Thank you so much. Good luck.
Yes,
Take care.
good luck. Thank you.